Okay. Yeah, we have to record ours too.
Um, I was told to probably we're gonna have to switch so that you host the Zoom call when you're the clinician due to recording going to whoever hosts,
Okay.
so we can switch it up in between.
Sounds good.
All right, so let me just get something ready to write on, and then you can get started.
All right.
So what brings you in today?
So I've been having some shoulder pain lately.
All right, and when did that start?
It started a couple weeks ago.
Okay, and what sport are you in?
Baseball.
What position?
I'm a pitcher.
Pitcher. And are you at the start of the season? How far in are you?
Kind of towards the beginning of the season. We haven't we've kind of scheduled practice like only for like a couple weeks, but I've been kind of like doing other stuff outside.
So you've been keeping up with your workouts before.
Yeah.
So you're not just jumping straight into this.
No, I've been kind of throwing before.
Okay. And um, could you try to point out with like one finger where most of your pain is?
I'd say it's like kind of like back here. Like, okay.
Okay. And is there anything that you feel kind of like aggravates your pain more than other things? Something that sticks out to you?
I'd say probably like when I like come back to start my throw, I'd say that probably aggravates it more.
Okay. And how are you sleeping at night?
I don't really notice it.
Okay. If you could give me a pain scale, like just sitting here, 0 being, nothing, 5 being you wouldn't really want to practice or participate, and 10 being you want to go to the hospital, where are you at sitting here?
Just sitting here and say it's probably like a 1.
1 out of 10? How about when you're pitching?
When I'm pitching, it's probably like a 4 or a 5.
Okay. How would you describe the pain?
I'd say it's kind of like a kind of dull or like kind of an achy pain.
Okay. Does it feel like it radiates or comes to a different area, starts feeling like it's moving throughout your body?
No, I'd say it kind of stays like on the back of the shoulder.
Mhm. Have you ever had a history of shoulder problems?
No.
No. Um, and let's see. Does it like hurt to do any daily activities like showering or anything?
I don't like not really too bad. Like I don't really notice it. Maybe like like kind of when I like come up a little bit like to wash my hair, but really nothing else.
Okay. So coming and reaching
Like
back.
kind of like yeah, like coming back like if I did that.
Okay. And then while you're sitting here, can you take your arm and raise it like straight above your head? Like that.
Not really.
And then from the side, come straight up.
That hurts a little bit, yeah.
It's a little bit. How about if you go straight back?
No, I don't really feel it there.
Okay. Across your body.
Not really. Maybe
And
like a little bit of a stretch.
okay, if you keep the elbow in and then come in and come out.
In doesn't really hurt, out does a little bit.
So you a little bit of stretch going like this, pain going out and coming back.
Not really any pain coming back, just kind of like coming out.
Okay. And let's see. If you were to like shrug your shoulders, anything that
Not really.
okay. Um, and do you hear any like clicking, popping, or anything?
No.
No. Um, do you ever get any numbness, tingling?
No.
No. Um, and have you done anything to help treat this?
I ice sometimes like after throwing, but other than that, I haven't really done anything for it.
And does that seem to help?
It helps a little bit, yeah.
Okay. Do you feel like your accuracy has gone down at all?
Not so much my accuracy, but I feel like I can't like throw the ball as hard as I like could.
So like your power seems to.
Yeah, I feel like it's a little weaker.
And are you still participating?
Yeah.
Yeah. Um, let's see. Is there any like lifts or uh, push-ups or anything that seems to aggravate it?
Not that I've noticed really.
And you said it started a couple weeks ago. Was there anything that you remember like falling or you know throwing and feeling like it came out? Anything abnormal?
Nah, just like couple like after a couple practices, I just remember it like kind of hurting.
Okay. Um, ever feel like your shoulder comes out of place and then comes back in or stays in the wrong place?
No, it feels pretty. The shoulder itself feels stable.
Okay. Uh, you ever feel like it just tightens up, getting headaches, anything like that?
No,
No. Um, and so, does it feel like the pain is up higher? You were kind of pointing here, or is it down lower, like on your scapula or like the bone, big bone on your back?
I'd say it's kind of like on the like bone on the back.
Yeah. To if you are like rolling over it, does it feel like you're going over a ridge where the pain is, or a corner?
No, it doesn't feel like there's any like bumps or anything really. It feels on. I mean, it feels like a little tender maybe, but
Um, all right. And then let's see. Um, and then if you were to let's see, I don't know if I have any special tests I could have you do by yourself. Trying to think of anything. Let's see. And then hmm, if uh, if you were to look in the mirror, do you see any bruising or swelling?
not really. Like there's no bruises, and I don't think it's really swollen at all.
Yeah. Have you ever been told that your scapulas sit any odd way or
No.
okay. Um, and let's see, how's like swinging? You talked about pitching. Anything bad with swinging?
Um, Not really. I don't really notice it. I mean, like I don't bat a lot since I'm a pitcher, so I don't really like judge. I haven't really judged it that well.
All right. So basically, most of your pain is just that wind up when you.
Yeah, I feel like kind of when I come back, I can feel it here, and then kind of when I like start to get kind of towards the like deceleration of my throw, I can kind of feel it.
Mhm. Um, all right. So I think that's about all the questions I have for you. Um, I definitely think it's related to your scapula. It's probably something to do with the musculature back there. I would have to be able to do, I guess, MMTs to narrow it down better, but um, maybe it's just yeah, scapular musculature. I'm not sure which one. I can't tell exactly where you're pointing or know with MMTs, but
Yeah, I know. Yeah, that ours was so it's supposed to be like a posterior rotator cuff strain. So,
okay.
yeah, I mean, you're pretty on, but yeah, I was the whole time when I was writing it up, I'm like, without them being able to like do MMTs or special tests, I'm like, there's no way they're gonna get this.
Yeah. Well, I think that's about it for me. I think you'll be able to get mine if you ask the right questions. So
Okay.
if that's it, I'll end the call and then um, you can email me your Zoom link or however you
Yeah.
want to do it. All right.